If you experience severe pain in the pit of your stomach, and this pain comes with intense vomiting and radiates strongly to your back, then this is a symptom of pancreatitis. As doctors, most of the time we tend to forget about the pancreas when a patient comes to us. When someone has pain in the pit of the stomach along with vomiting, we immediately suspect the stomach or the gallbladder. Even if the pain radiates to the back, we might suspect the stomach ulcers, or acute inflammation of the gallbladder or stomach. And we always forget about the pancreas, so we made this video specifically about the pancreas. Let's start by talking about the symptoms of pancreatitis. In acute pancreatitis, the patient experiences sudden pain in the pit of the stomach, and this pain is extremely severe. So if we ask you to rate the pain out of 10, you might say 20 out of 10 or 100 out of 10, not 6 out of 10 or 5 out of 10. It's excruciating pain. This pain is characterized by radiating to the back in the same area opposite the pit of the stomach. Many patients also experience vomiting. It's excruciating. It doesn't stop. So doctor, how can we be sure if this is really coming from the pancreas or just a gallstone? Fortunately, there is a specific test for the pancreas that we call lipase and amylase. But unfortunately, their levels don't stay high for a long time. They are only elevated when we do the test at the onset of symptoms. We find that the levels are elevated. Their values are more than 3 times the normal range. And this indicates pancreatitis. But let's say at first you thought it was the stomach or you thought it was the gallbladder. And you didn't take quick action, didn't do the necessary tests, and started taking something just to relieve the pain and something to reduce the vomiting, but the pain persisted. At that point, we proceed as follows. We do a CT scan of the abdomen, and most of the time we use contrast dye to confirm pancreatitis, and this reveals the condition to us. In more than 90% of cases, when doctors request this test and confirm pancreatitis, it can't be treated at home. Treatment is always in the hospital, and there is a specific treatment we give to prevent further pancreatitis, along with administering fluids. We make sure your blood fluids and electrolytes stay normal, and we give you medications intravenously because we can't give you anything orally. During your hospital stay, you'll receive fluids and medications through an IV. This is to help relieve your symptoms. Then, once your symptoms subside and stabilize, our doctors will start to let you take fluids orally again. After that, well, is there any vaccine that can protect us from it? Unfortunately, no. So, what could cause it? What causes pancreatitis, doctor? There are various reasons. Let's start with the most common ones. The 2 most common causes of pancreatitis are problems that can cause a blockage in the bile duct or in the duct coming out of the pancreas, which meets the bile duct. For example, gallstones or issues that occur after we perform imaging of the bile ducts. Adhesions can occur in the duct coming out of the pancreas or in the bile duct itself. If gallstones get stuck in the bile duct, they cause this. So what else is common, doctor? A very high level of triglycerides in the blood. Drinking alcohol. This can also cause it. So what about fats? What should we do about them? Some people might think it's the bad cholesterol or total cholesterol, but no, everyone. We're talking about triglycerides and their levels. What worries us are inflammations. When the pancreas level exceeds 800, and most of the time it goes over 1,000 or even 2,000. So let's agree. When triglycerides go above 1,000, 5% of patients with triglycerides higher than 1,000 can develop pancreatitis. When triglycerides exceed 2,000, the risk increases significantly. So for those with triglycerides at 200 or 300, so don't worry if while watching this video your numbers are much lower. Now, regarding alcohol, unfortunately, there isn't a specific amount that medicine can determine as safe when it comes to drinking alcohol that could lead to pancreatitis. So it's better to avoid it altogether. Now there are other causes, but they're not very common. Like what? For example, there are some viral infections such as HIV, CMV, NKF, KBDP, herpes simplex, and herpes zoster. Viruses that cause diseases, and there are also some types of bacteria like Salmonella, and some types of worms like Ascaris. What other diseases, doctor? If you get hit hard with a stick on your abdomen, right where the pancreas is, this could happen. There could also be a tear in the pancreatic tissue. What else, doctor? In some people who have congenital problems in the pancreatic tissue, this could happen to them. And some people who have genetic diseases and inherited this through their family genes. And there are other people who have autoimmune diseases like lupus or immune vasculitis, which can also lead to inflammation of the pancreas. The surprising thing is that there are some very well-known medications that can cause inflammation, even though people might not focus on them or pay attention to this. The most well-known of these medications are aspirin and metronidazole, which is considered an antibiotic with many uses. Many people use it as an intestinal antiseptic, and some use it as an antibiotic for dental infections. Sometimes it is prescribed along with other medications at times. In some women's and childbirth-related issues, the improper use of vitamin D or calcium can raise the level of calcium in the blood. And as a result, it can cause problems. It can also cause inflammation, so we need to be very careful with the medications we take. We should always consult the doctor, as they are the one who determines the correct dosage and the duration for which we should take it. So now we've discussed the causes, and there is a lot of people listening to us right now might say, "Doctor, you scared us too much. I don't want to take anything at all." On the contrary, I want to shed light on the fact that not every pain you feel in the pit of your stomach that radiates to your back. It's not always gastritis, it's not always acid reflux, it's not always a suspicion of gallbladder issues. We always forget about the pancreas, the forgotten organ. So, we should always consult a doctor when we experience similar pain. We start with the most common, the most well-known, and the most likely causes if there are no warning signs. We perform the necessary clinical examination and request the required lab tests or imaging to confirm or rule out the possible cause. I hope the video was useful for you all. If you found the video helpful, please give it a like. And if you haven't subscribed to the channel yet, you can subscribe so you don't miss any of the videos we make. God willing, I'll see you again soon.